Hi, my name is Cassandra Jackson, and I am a psychiatric mental health nurse practitioner student. Reflecting on my journey into the field of mental health, I can't help but recall the impact that my interaction with individuals facing mental illness have had on me. One significant moment that stands out in my mind was about 3 years ago while working as a family nurse practitioner. I had a patient who came into the clinic for a follow up visit. What should have been just a routine follow up for chronic primary care condition turned out to be a mental health intervention. She was obviously in a state of extreme stress, and this stress yelling about what was happening and how everything was not going well. She stated that she felt like walls were closing in. Luckily, the facility I worked at had an available therapist that she was able to see and start same day therapy sessions. Upon her return to the clinic about 2 weeks later, she thanked me for helping her to get her life back on track. Another case that I can recall is a young lady who came in with abandonment issues. She stated that she was unable to maintain any meaningful relationship, and it did not matter whether they were with male or females. Her most recent partner, she stated, had just ended the relationship with her, and she was planning on hanging herself. She stated that she had attempted suicide in the past, which was unsuccessful. However, this time she had a solid plan. She agreed to a higher level of care and was transferred to the hospital by the local authorities for safety. Her follow up went well. She started therapy and stated that she was starting to maintain better relationships. From a young age, I've been drawn to understanding the complexities of the human mind and how it shapes our experiences and behaviors. Growing up with a family member who struggled with severe depression, I witnessed firsthand the toll that mental illness can take on both the individual and their loved ones. These experiences ignite within me a passion to advocate for mental health awareness and to pursue a career where I could and can make a tangible difference in the lives of those affected by mental illness. That being said, while growing up, my family did not really talk about mental health. This was looked at as a taboo, a curse, or that someone must have placed a spell on the person causing the individual to be the way they were. I grew up in Jamaica where there was a stigma of accepting a mental health diagnosis, causing delayed care and often no treatment. Reflecting on this norm is so sad. My reason for specializing in psychiatric stems from a deep desire to provide cultural competent care with compassion and support individuals who are often marginalized and misunderstood. I believe that everyone deserves access to high quality mental health care free from stigma and discrimination. By working with this population, I intend to contribute to the destigmatization of mental illness and promote holistic wellness. Entering into this clinical rotation, I carry with me a mix of excitement and apprehension. While I feel confident in my academic preparation and clinical skills, I am mindful of the emotional challenge that may arise when working closely with patients experiencing acute psychiatric symptoms. I am particularly concerned about ensuring that I provide culturally competent care and maintain professional boundaries while building therapeutic relationships with patients. Also, I am aware of the potential for burnout in a demanding clinical setting and the importance of self care to maintain my well being. During this clinical rotation, my main personal goal is to deepen my understanding of psychiatric practices and sharpen my clinical assessment and intervention skills. I aspire to cultivate empathy and cultural humility in my interactions with patients while recognizing the unique strengths and needs of each person. Moreover, I am committed to advocating for the integration of evidence based practices and trauma informed care approaches into my clinical practice. On an academic and professional level, I intend to expand my knowledge base through ongoing learning and collaboration with other interdisciplinary team members. Ultimately, my goal is to become a competent and compassionate psychiatric mental health nurse practitioner who can empower individuals to embark on their journey towards recovery and resilience. Thank you.